I'd like to let the residents of Lunenburg know some important information about Medicare. My name is Heather Hurd. I am a senior plan consultant at Blue Cross and Blue Shield of Massachusetts. Right now, we are in the Medicare Advantage open enrollment period, which lasts from January 1 to March 31. So if anyone listening to this broadcast is on a Medicare Advantage plan and you're thinking about changing that plan, you can do so up to March 31st. What you can do during this time frame is change from one Medicare Advantage plan to another plan, and that includes changing to a different company, insurance company. You can also disenroll from a Medicare Advantage plan by March 31st. You would go back onto original Medicare, and at that time, you're allowed to buy a Medicare supplement and a separate Part D plan. So this is important information for everyone to know. Other information I wanted to give you is general information about Medicare. If you are not yet on Medicare, but that's approaching, and that's typically for someone age 65, you might be thinking, what is it I need to know? So my key messages for you are Medicare can be complicated, so don't wait, start early. A good time frame is about a year in advance. Start looking online. Medicare.gov has a great website, learning what you need to know. And also, since I am from Blue Cross and Blue Shield of Massachusetts, I'm here to tell you that we have tools to help you. On our website, we have tools to help you understand Medicare and pick plans. We have regular webinars about our plans. We also do public sales seminars about our plans, and these are all free and they're held at hotels. We also do educational programming, and we do go into the Lunenburg Senior Center, and we'll also be having a program in June, which I'll tell you about at the Lunenburg Public Library. So to take a real step back, let's talk about Medicare. This is health insurance provided by the federal government for people age 65 and older. Some people have Medicare who are younger because of a disability, after 2 years of disability. Medicare was enacted in 1965, so it's been around a long time, and it's made of parts A and B. That is original Medicare. Part A pays for inpatient hospitalization, and Part A is free for most people. As long as you've paid Medicare taxes, 10 years or 40 quarters, you qualify. Medicare Part B is covering you for outpatient and doctor care. And Part B, people have to enroll into, and there is a monthly premium associated with Medicare Part B. That premium is set by Medicare. It's set by the federal government. It can change every year. In 2023, it is $164.90 per person per month. So Medicare is individual coverage. That can be different from, when you've been working for an employer and you've been covering yourself, your spouse, your family. Once you go on to Medicare, you're on there on your own. So A is free. B, you're going to pay $164.90. That can come out of your Social Security check. And if you're not collecting Social Security, Medicare will bill you for that Part B premium. Part B also can increase for people who fall into a higher income bracket. To sign up on Medicare, you're going to work with Social Security, and you can sign up as early as 3 months before your Medicare is to take effect. Now, I'm on the senior outreach team at Blue Cross and Blue Shield. Our team works out in the community, and we meet a lot of people who tell us that they're not going to go on to Medicare at 65. They're going to keep working. And if you decide to keep working and your employer has 20 employees or more, you can make a choice then. You can waive that employer coverage and go on to Medicare at 65, or you can delay going on to Medicare and keep your employer plan. And in this case, you can delay Part B and not pay that premium monthly as long as you have that employer coverage. And then later on, when you decide to stop working, you're going to go back to Social Security and say, now I'm 70, now I want to go on to Medicare, and you'll enroll onto Part B. So original Medicare was meant to provide people with core benefits. it was never meant to be comprehensive coverage. So there are some deductibles for hospital. There's an annual calendar year deductible for Part B. And generally speaking, the Part B services, the outpatient doctor care, is covered at 80% after that Part B deductible is met. And those costs are set by Medicare. So oftentimes people who go onto Medicare, they want more coverage than Medicare, and they'll look to buying other plans. Another reason for that, because of the cost sharing, is that Medicare doesn't cover prescriptions or a lot of preventive services. So people will buy supplements in addition to Medicare, and then separate Part D plans. That's one way people get their coverage: Medicare, supplement, Part D. Another way is to buy a Medicare Advantage plan, and that's the open enrollment period we're in now. An Advantage plan is an HMO or a PPO type of plan. It becomes the primary coverage and covers Medicare benefits, extra benefits, and drug coverage. When you're going on to Medicare, it can be a very overwhelming time. So there is also a wonderful state resource for you called the SHINE program. That is an acronym. It stands for Serving the Health Information Needs of Everyone on Medicare. So we call it SHINE because that's a very long name. SHINE counselors are available at the Lunenburg Senior Center. These are very dedicated, mostly volunteers who learn about all of the Medicare plans that are available, the enrollment periods, the timeframes. They also know how to help you avoid late enrollment penalties with Medicare. There can be late enrollment penalties if you do not sign up at the appropriate time. So definitely take advantage of SHINE and see the people at your senior center, or I'll give you contact details how to reach them at a toll-free number and website as well. So I realize this is a lot of information all at once, but just know that there is education out there on Blue Cross Blue Shield's website. We present all our plans on Zoom and in person at seminars, and we do educational programs in the community. I'd like to mention one coming up in Lunenburg. We have a program at the Lunenburg Public Library on June 8th from 6:30 p.m. to 7:30 p.m. And this is called Understanding Medicare for Caregivers. So you don't have to be a caregiver to go to this public educational program at the library. It's really going to educate you on Medicare, whether you're on Medicare or whether you are taking care of someone who is on Medicare and you are a caregiver. So I just thought I would mention that. Here are some important websites and phone numbers for your reference when you have questions about Medicare. Thank you again to the residents of Lunenburg for having me on your local cable to remind you about the Medicare Advantage open enrollment period. This ends on March 31st, which is this Friday. So if you have a Medicare Advantage plan and you're thinking about making a change, that should be done by Friday. After that, if you want to change your Medicare plan, there is an open enrollment period every year in the fall from October 15th to December 7th for a January 1 effective date. This is when people on Medicare can make any change they want to their plan every fall for January 1. Thank you so much for your time, and we look forward to seeing you at the Lunenburg Public Library on June 8th.